Gentlemen, play good.
Good luck.
Good luck.
Good luck.
Hope you finish second.
There are some things that just come with being Dr. Byron Williams' son, and this would be one of them.
Ooh, stripe that one right down the middle.
But if you ask his sons, or his daughter for that matter, they'll tell you it's not a bad thing. Golf is just one of many things that, despite a time-consuming and demanding profession, Byron Williams has taken the time to do with them.
I don't know how he's able to do it. I mean, clearly he had a good wife that helped him maintain that balance.
Her name is Barbara. The two met at the University of Florida while she was studying nursing and he was in medical school. It was she who helped him find the balance to be a physician and the kind of father who found time to spend with his daughter and 4 sons.
The balance, and it's something I try to strive for in my career, is to try to be as good as he was at what he does, but also make time for my family and my children as well.
That balance wasn't the only thing Byron Williams passed on to his oldest son, Robbie.
Whether I knew it or not, it was in the stars that I'd end up doing this. 24 hours.
Like his father before him, Robbie is a cardiologist at Emory. That theme of passing on his passions is a strong one in Dr. Williams' life. You can see it today as he works with residents and fellows, but you can also see it if you look at how he became interested in medicine as a child in small-town South Carolina.
And I think my grandmother had a lot to do with that. Her father was a small-town doctor in South Carolina, and I think I, being the first male on that side of the family as a grandson, she kind of pushed me in that direction from day one.
She didn't have to push hard. Dr. Williams excelled academically. Through medical school in Florida, residency in South Carolina, always planning to return to his small-town roots.
That's where I thought I was going to end up. But along the way, I got fascinated with cardiology and decided to pursue cardiology training, and that doesn't lend itself to living in a small town.
But it did lend itself to doing a fellowship at Emory University, a place that, with names like Hurst and Logue, had become a leader in cardiology.
Oh, it was a fantastic place to be, and they were at the pinnacles of their career, and so it was, in my mind, the premier place to train if you wanted to be a heart specialist.
After finishing his fellowship, Dr. Williams joined the faculty and started work at the Carlisle Fraser Heart Center. It was a rapidly growing center in a rapidly growing area of medicine, and when nuclear imaging emerged as a new diagnostic tool, it was Byron Williams who went to Yale to study it.
I can't remember whether I walked out of the room and they said, Dr. Williams is going to be the guy we're going to send off to do this, or not, but I'm glad they did.
This was one of the things that Carlisle Fraser has done repeatedly, is bring new technologies and new therapies to the Atlanta community, and Byron was the point person for doing that at the Carlisle Fraser Heart Center.
You can see there's an enlarged left ventricle.
Although, after more than 30 years, Dr. Williams is a force all his own in cardiology. He takes the responsibility of carrying on the traditions of his mentors very seriously.
I believe that the individuals that learned from these giants, from Dr. Hurst and Dr. Logue, are the embodiment of those two individuals now and are carrying on their work. And just as we feel indebted to the people that taught us, that debt is in large part paid by passing that on to the people that we teach.
And that's just what Dr. Byron Williams has done with over 1,000 students, residents, and fellows, bringing his experience in imaging and in patient care to the next generation, a generation that includes his son.
It's very easy being his son. He has such a good reputation. He's so universally liked and respected. I figure if I go about my business the way he did, and he does, that any of that stuff will take care of itself.